your eyes ever feel really dry, burning, itching, tearing, feel like there's something in them like sand, or just feel really irritated? You may have dry eyes. And today I'd like to talk about a specific type of dry eye. This is Dr. Kimberley Linert. I'm a behavioral optometrist, and you may be one of my patients that I have sent to see this recording because I want you to understand how to do a certain procedure that would help you if you have this type of dry eye. And it is called Meibomian Gland Dysfunction. So people have dry eyes for many different reasons. It may be that they're not drinking enough water. It may be that you have allergies or sinus issues, or you're on a screen for too many hours and you're not blinking enough. It could be dry eyes from certain health conditions or medications you're taking, or even environments that you're in. Some people work in very dusty or dirty environments or dry environments. Many healthcare workers who work in hospitals complain that it's so dry in hospitals. So there's a lot of different reasons for dry eye. And this is not about talking about every single thing about dry eye. I do want to specifically talk about meibomian gland dysfunction. And it's a certain disease where your meibomian glands are clogged. And so the mechanism in which your eyes work, as far as keeping them wet, isn't working anymore. Now, so your tears are made up of three things: water, oil, and mucus. And you need all of three of them for the eyes to be balanced and for the tear mechanism to work properly. So the water part hydrates or keeps the eyes moist and wet. The oil part mixes with the water so that the water actually sticks on the eye and creates that nice smooth surface. And the mucus part is a protective part. If your eyes get too dry, mucus will come and coat your eye, because your eyes cannot dry out or they won't work properly. In fact, they'll die because the cornea, the clear part on the front of your eye that you see through, that's clear like a window, is only clear because it has no blood vessels in it. If it had blood vessels in it, you wouldn't be clear and you wouldn't be able to see through it. And so most of the food and water that the cornea gets is from the front surface tears. When you blink, you create a clean surface of tears. Your eyes are wetter, and they also, you see clearer because it's not a degraded image. And if that's not happening, mucus will come and coat the eye, and sometimes you might get a blurry or filmy look to your vision, or even kind of rainbowy looking vision, because there's mucus coating the cornea, and it's not as smooth and nice as a nice clear layer of tears. So meibomian gland dysfunction. Meibomian glands, first of all, let me share my screen here. And we'll start with this picture. So this is a picture of your meibomian glands. And as you can see, there's these glands are on the bottom and top lid. So you have your lashes here, but these glands are separate. So they're on the bottom and top lid, and they open along this lid margin here and along the lid margin on the top lid. And normally what happens when you blink is the two lids squeeze together and a little bit of liquid oil is secreted and mixes with the water part of the tears, and then the tears stick on. But when that doesn't happen, your eyes feel dry, burning, itching, tearing, irritated. Sometimes like there's sand in them, or just really uncomfortable, and your vision can get blurry. And a lot of people have these glands that are clogged. The most common reasons for glands clogging is allergies or sinus issues, or people who look at screens all day because they tend to not blink enough. So what happens is these glands can get very, very clogged. So here's a picture. You see, here's your lashes, and here's the glands. And this person, their glands are really clogged up. So there's no oil coming out of those glands. So when they blink, the tears are secreted, but there's no oil to make the tears stick on to the eye. And so sometimes people just get a lot of tearing and they'll say, people say my eyes are dry, but I'm tearing all the time. They're always wet and watery. Well, the tears are rolling off because there's no oil to help the tears to adhere to the front of the eye. Some people have glands that they're clogged, but not as much. So you see the oil is kind of thickened and piled up here, but it's not totally clogging the glands. So some of the glands might be working. And a lot of people, you'll look at the glands and they're all capped off like this, or you can even take a look at them using pictures. And here's a picture of glands to see if the oil glands are full of oil. So, taking a look at this picture, this first one is a picture of someone with normal Meibomian glands. There's oil in them, it's liquid oil. And if you look along this lid margin right along here, it's all nice and clear. So, what's happening is when they blink, the two lids squeeze together, a little bit of liquid oil squirts out, mixes with the water part of the tears, then the tears stick on. The second picture over here, this person has clogged glands. If you look, there's some little dots here along the lid margin. That's where the glands are clogged. And as you can see, some of the glands are missing. So because there's inflammation in here and your own bacteria, it starts to eat away at the glands if they stay clogged too long so that you don't have any. So this person's probably feeling a lot of symptoms as far as dry eye. If you go to this third diagram, if you look on the edge, you see all those little tiny white dots are a little hard to see, but they're little tiny white dots. That's like that first picture I showed you where the glands are very clogged. And they've been clogged so long, and because there's inflammation in here and bacteria, that is eaten away all the glands. So if you ever seen, especially an elderly person, that their eyes are just pouring water all the time, they're like constantly tearing, they have a handkerchief, they're holding up against their eye because their eyes are just won't stop watering. They're miserable. Their eyes are so dry, they're burning, they're hurting, their vision is blurry, and they're just really miserable because they don't have any glands left, and those don't grow back anymore. And we don't ever want to get to this place where we have this severe loss of our glands. And so to counteract that, there's a procedure you can do every night that helps to move this oil and unclog it. And to do that, we use heat. So at night, before you go to sleep and after you've taken your contact lenses out, if you wear contact lenses, you're going to take a moist heat eye mask. Now, this is a mask that you can put it in a microwave. So you don't want to use anything like a heating pad or anything that gets really hot that's not moist. The key word here is moist heat. So you want to use moist heat and you want to heat up those glands. So you can get eye mask like this. This one's from Target, but you can get one at Walmart. You can get one at CVS or any pharmacy. You can get it on Amazon. But the key is moist heat mask. So you put this in the microwave for 20 seconds and then put it over closed eyelids for 10 to 12 minutes because it takes 9 or 10 for the oil to soften in those eyelids. So for 10 to 12 minutes, you want to put it over your eyes. After you remove that from your eyes, you're going to massage your eyelids. And here's what I mean by that. If we go back to the picture of the glands, you see how they're on the bottom and the top, and they open along this lid margin here. And you'll see in this picture of the actual eye, here's your eyelash glands where the eyelashes are coming out, and here's your actual meibomian gland openings. So that's how close they are. Now, these glands are only 5.5 millimeters long, which is half a centimeter. They're not very long. They're just really tiny glands. So what you want to do is you want to massage the glands. So you just take one finger and you push in and up, in and up, in and up, all along your lid margin. So if I go back to here. So you just want to take a clean finger and push in and up, in and up, in and up, in and up, all along the lid margin. And then look down because it's really sensitive, and look down and just push down and in, down and in. And the same thing on the other side. You're just pushing along there. You're trying to squish some of that oil out of there now that it's gotten softened. I've seen people on YouTube showing people to like rub their eyes up and rub them down really hard. I don't recommend doing that. Those glands are very tiny, and if you do that, you might be scratching on your eyes. So just gently push in. They're very small. Like I said, they're very tiny, tiny glands. Just push in and push in on the top. And then after you've done that, go back to share here. After you've done that, you want to rinse really good because when that oil comes out, it's got that bacteria in it, and you don't want bacteria in your eye when you're going to sleep. So you want to get a big bottle of saline. So these aren't the little tiny drops of eye drops that you put in when your eyes are dry. This is the big 12-ounce bottles. So you want to get saline, and you want to really rinse and flush your eyes. So just hold a cloth up but next to your face so that you don't get all wet. And then just open your eye real big and take the saline and just really rinse it, rinse and rinse it really, really well because you want to get all that um, oil that's got the bacteria in it out of your eyes. And once you've done your saline, then you want to take just a cold cloth and put it over both eyes for 2 minutes. Why do you do that? Because from all the heat, sometimes it'll make your eyelids swell, and you don't want to wake up in the morning with puffy eyes. So just to calm everything down, you put the cold cloth on over your eyelids just for a couple minutes, and then you go to sleep. Now, I recommend that you do this every night for the next 4 to 6 weeks. If yours is really severe, maybe 4 to 8 weeks, because it takes time for that oil to actually get moved out. So the more you do it, the more the oil is going to move out. And then once that dead or thickened oil is moved out, it takes time for your eyes to start producing the good thin oil that needs to start working again properly. Some people start to feel better even after a few nights of doing this. And some people it takes a little bit longer because their eyes are more severe and they're more clogged up, or it's just been there for a very long time. Also, people who have allergies or chronic sinus issues, they tend to have to do this more often. But after that initial treatment, whenever your eyes are feeling dry or uncomfortable, just pull that technique out and just do it again, just to get everything clear and moving again. And that should give you a lot of relief. The other thing is during the day, if your eyes get dry, you can use some artificial tears. Also, make sure you're drinking enough water and that you're avoiding caffeine and diet sodas because they have Splenda or sucralose, something that sweetener in them causes your eyes to be dry. So you want to avoid that. So 1 cup of coffee in the morning is fine. Drinking coffee all day is going to dry out your eyes. So hopefully that really helps. And if you're one of my patients, you can always talk to me and ask me any questions you have. If we haven't met yet, you can meet me on social media. I'm just under my name, Dr. Kimberley Linert, Kimberley. Linert, and ask me any questions there if I can help you at all. And I will be talking to you again soon. Please, subscribe, like the channel if this has been helpful. Hope you have a great day.